Do you want to look better? Have you ever thought about starting a skincare routine and you don't know where to start? Welcome to Session and Secret.
Menopausal time, that's when you start losing a little bit of your bone structure.
You tell them about, the wrinkles and...
One of us sitting here, we probably have something that we are self-conscious about.
Welcome to Session and Secrets. Today, I'm here with a very special guest. She is a registered nurse, an expert injector, and the founder of the Aesthetic Intention, Carol Nguyen.
Hi, Luisa. Thank you so much for having me on today.
And Carol, tell me more about what you do.
Yeah, so I'm a registered nurse. I am recently the founder of the Aesthetic Intention in Costa Mesa, California. I do have a background in acute care in the hospital, as well as plastic surgery, and I've been practicing aesthetic medicine for over 5 years now. And I offer advanced injectables. I focus on skincare health, and I have passion for making others feel confident and radiant in their own skin.
What are injectables? Tell me more about them.
Yeah, so injectables is very much so a broad umbrella term. There's so much that comes into it. People often mistaken it as anti-wrinkles being the same as filler, but they're completely, totally different. And so we have anti-wrinkle injections where it works on your muscles and it helps soften lines and wrinkles so your skin doesn't crinkle like a piece of paper, if you will. And then you have hyaluronic acid fillers where it's more made up of a sugar molecule, and it provides plumping to the skin, volume, structure support, whatever you need. And lately, with advancements in the technology, we have more non-invasive machinery as well as more regenerative approaches as well.
And what's the difference between invasive and non-invasive procedures?
So you have invasives, you think invasives, you go to plastic surgery, right? And non-invasives are more things that you can do in office with very minimal downtime. You can resume your day-to-day routine. Maybe some treatments might require a little tiny bit of downtime, some redness to the skin, some swelling, maybe some bruising, but it doesn't affect your day-to-day and you can resume going to work. Yeah.
Okay. And what are the most common concerns you see people that come into your office?
That's a really good question. I often see a lot of clients come in and the first thing they noticed is them telling me, I don't like this line, I don't like this wrinkle, I don't like these folds in the center of my face. And a lot of times it's a lot of educating and telling them the causation of what they're seeing, right? Typically, they would think that you just put filler or Botox in those lines and that will kind of take care of everything. But there's just a lot that comes into play with the aging process. And that's where advanced injectables come into play to kind of help mitigate that.
Mm-hmm. And so what do you tell them about, the wrinkles and...
Yeah, so what you see when I tell them, honestly, whatever folds they're seeing, whatever lines they're seeing, I'm educating on the cause of that. And like I said, it's down to the aging process. And a lot of people, we age mid-face onwards, right? Because start from the mid-face, it can even start from the temples. And for bone structure around menopausal time, that's when you start losing a little bit of your bone structure and support. And so depending on what their needs are, on our assessment, that's exactly what I'm consulting them about. And I'm feeling where they're losing the volume. And that's where filler comes into play. And if it's a lines and wrinkles type of thing in your upper face, that's more of a muscle type of thing, and you have to use anti-wrinkle injections. So it's a very comprehensive approach to care when I'm treating clients, but basically just a simple fold center of the face. It's not a simple one and done. It takes a whole lot of analysis. It takes a whole consultation in order to define what the actual causation is, and that's how we treat accordingly for the most natural results.
What about like the second chin, Carol?
The second
what can
chin,
I do about that?
The double chin. Okay. So honestly, I like to tell my clients, like, if that is the issue that you have here, if you have a substantial amount there, to be honest, I always take it back to diet, exercise first, okay? You gotta start from ground one. That's the most important. I don't like to treat the area, whether it's adding volume or whether it's taking volume out, if I know that the patient has not done what they need to do at home first, right? And so diet, exercise first. And if they really need to, they can seek into maybe fat dissolving injections, right? That is a thing too. And if it's just too much and it's not enough for, a non-invasive procedure, then I would refer them out to plastics to do lipo, which is the gold standard for that area.
Oh, okay. Well, that's
Yeah.
good to know. Good
Yeah.
information. And Carol, sometimes I wonder if this like fillers or injectables, if they're a sign of low self-esteem or if they're a sign of self-care. What's your perspective?
Yeah, I think that's a really, really valid question to have. But my philosophy is I think that every single one of us, right, we struggle with some sort of self esteem, something that we are not happy about, right? And it's human nature, right? But I also think that it is a form of self care. Not everybody getting these things is a form of vanity or just, insecurities. It's true empowerment. I find that if someone feels unhappy about something and they're actually taking measures to do something about that, I feel like more power to you. And so to answer your question, kind of both, right? But yeah, I feel that with today's technology and today's treatments that are easily accessible or offerable. So to answer your question, I think that's a really good one. I feel like in today's day and age, yeah, like all of us, every single one of us sitting here, we probably have something that we are self-conscious about, right? That's just human nature. And so luckily we have these technologies and treatments that are available to help with that. However, I also think it's very empowering to say, I don't like something. I'd like to correct that and actually take emotion into doing that. I think that's more power to you. And it's a seem as a self-care type of thing as well.
Yeah, I think that it's, whatever makes you feel comfortable in your own
Yes,
skin, right? Like
exactly.
whatever's going to make you feel comfortable as long as it's not harmful, as long as you're taking care of yourself
Exactly.
and it's
100%.
healthy,
It's
right?
healthy. It's not harming anybody. And you'd be surprised the stories I hear for my patients who come in, it's far beyond just the vanity aspect. They come in because they're a busy mom that barely have time to take care of themselves. And this little thing is what is going to make them feel happy and fulfilled in that very moment. And so I think it's very, very important it's very special basically too.
Yes. And what are some of the most popular non-invasive treatments right now?
Yeah, so non-invasive treatments, the most popular I think are things that are boosting your own collagen production, right? So we have your fillers, we have your anti-wrinkles, and that's just non-negotiable. Obviously, it's have its uses. However, we're gearing towards more of a natural approach. So we're dipping into things that are more regenerative, are more waking up your body's own natural collagen production and providing that gradual volumization over time. And so I think it's great that we have both options and patients are not limited to what they can do. But I will say that there's a use for every single one of them, and one doesn't negate the need for the other, basically. But those are very, very important and popular. And even skincare focused treatments, right? Whether it's lasers or microneedling, those are always going to be important for our skin health. And I think that we're going to see more and more people gearing towards that for sure.
And what if someone can't afford all these procedures?
Yeah.
What do you think? What's necessary? What's something they can do at home to prevent or take care
Absolutely.
of or slow
Yeah.
down the process of
Yeah.
aging?
Yeah, it's all about preventative. I feel like luckily we have the luxuries of having these type of treatments in office, right? But a lot of times I tell my clients it's all about wellness. It's all about how you take care of yourself at home, right? So you can't spend all this money and just forget about skincare at home. It's all down to the basics. What you consume, what you eat. Are you working out? Are you active? Are you protecting your skin? Right? Are you having a regimen at home? Those are all the very important things like sun protection, right? I feel like everybody has access to SPF. Right. I'd like to think so. And, just things like that to keep yourself healthy, I feel like it really shows on your face and your signs of aging. And so if you can't even dabble into this yet, take it back to the basics. What's the most important? Those are the most important.
Right. So like the basics, going back to the basics.
Exercise. Yeah, diet, exercise, skincare, SPF. And if you want to talk about SPF, honestly, I feel like everybody needs sunscreen. Everybody needs vitamin C in the morning. Okay, non-negotiable. Everyone needs a retinol at night, right, for anti-aging. And then the sunscreen in the morning, at least 50 if you can.
Mm-hmm. And what is facial balancing?
Yeah, you hear that all the time on social media, facial balancing. And Facial balancing is basically a different approach to injectables where they're focusing on the full face analysis rather than just augmenting one certain area only, right? And so when treating the full face as a whole, you kind of think, oh my goodness, that's going to be so much. I'm going to look so different. But in all honesty, it's actually going to do the exact opposite because you're treating the face as a whole. Everything kind of comes together in harmonization and looks more natural in a sense where someone might look at you and be like, oh, I don't know if she's gotten anything done actually. And that's because they focused on the whole picture, not just one isolated area. So that's kind of what brings balance to the face.
So like harmony, harmony.
Exactly. So for example, you can treat one isolated area only, then it's going to throw off the balance for another because you're volumizing that area. Does that make sense? So basically that's what it means when it comes to facial balancing. It's my personal favorite treatments in the office to perform.
Okay. And do you think that we live in a culture that glorifies perfection and staying young?
Yeah, honestly, I would have to say and agree that it kind of does because with Hollywood, right, and the standards and everything is perfect on social media with influencers, we often forget that what we see online is not 100% real and raw. And, we need to understand that that's okay. There's limitations on what these treatments can do, but also it's just not realistic to have to live up to those type of standards. So even treating patients in my clinic, I always have to remind them that, listen, there's limitations on what this can do. This can tweak it up a little bit. This can elevate something for you, but it's not going to change everything. But at the end of the day, that should be the goal. It should be only tiny enhancements, not to augment everything and make it look picture perfect, like what you're seeing on filters.
Right. And I think like even when it comes to mental health, right? Like if you're chasing the impossible, then it's becoming I'm not going to say an addiction, but a void, right? That is that there's a need for it to be fulfilled. Whereas what you're talking about is like doing this thing so that you do feel, maybe like confident or that you do feel secure in your own skin, which is different than always chasing the impossible.
Exactly. And the chasing the impossible and chasing perfection is very common in this industry. I see it all the time. And when I have a patient in my chair that is unrealistic or they're chasing perfection, then either our relationship is not going to work well, or I kindly just refer them out to another provider that could maybe meet their needs more, or maybe a plastic surgeon that could better, help with what they need to do. But yeah, I've seen that all the time and having to chase the perfection. And I often have to remind them that perfection does not exist. And so, yeah, you'd be surprised. That is very common too.
Yeah. And are there any risks or side effects that people should be aware of?
Yeah, so absolutely. So first of all, there's some benefits as well. And you get radiant, you have confidence, you love your skin, you love everything. It looks good, right? But there's also that risks that comes into play that people are not aware of, I don't think, such as getting treated with fillers and with anti-wrinkle injections, right? If not performed by a licensed provider, there can become dangerous risks. For example, skin death, right? What's called vascular occlusion. When a filler gets lodged or clogs up a vessel, right? And then you're not getting oxygenated, you're not getting blood flow, the skin dies. And so these are the really, really big risks that people need to be aware of. And you're not going to someone in the garage, you're not going to someone unlicensed, someone that's cheaper. Those are the main risks, not even mentioning strokes and blindness.
Yikes.
Right? In very, very high risk areas. So not to fear monger, but those are the realities of it. And so you really need to go to someone that knows how to navigate adverse events and that is properly trained and supervised by a physician.
Yeah. A healthcare provider, right? In the field.
100%.
A professional.
Yeah. Mm-hmm.
And what are some common myths, or what's one myth that you can debunk?
Okay, I love this. I think that one myth that I can debunk is that injectables ages you. I feel that yes, in the wrong hands, it definitely can age you when you're overfilled. The provider doesn't know the limits, right? Pushing the boundaries. That's when someone starts to look overfilled and funny. However, not every single injector or provider is going to have the same results, right? So not all the time that just anti-wrinkle injections and filler and all of these treatments are necessarily going to make you look aged. For example, there's some A-list celebrities that I know you see on social media all the time. You'd be surprised that they actually do have work done. And that's because it's in the right hands of the provider and they don't look aged. It looks actually reversed. Yeah.
Right. It looks more natural.
More natural. That's the aesthetic that's more pivoted now. It used to be maybe the overdone look. It used to be the overfilled look. You want to look like you actually have something done. But now it's been different. And you can see the aesthetics is kind of pivoting to more of a natural aesthetic. And that's why, it's not common for reversals to happen. People are reversing some of their old work and getting more refined work done. And I am totally all for that as well.
Yeah. Like this is where less is more.
Less is more. Right? Yes, absolutely. Less is more and focusing on the integrity of your skin and your skin health. Yeah.
Yeah. And are there any trends right now that you think are underrated?
Oh, underrated trends. So I am seeing a lot of different trends now that I actually want to try soon, like more of the regenerative, spinning your own blood, making it into a filler, right? More of a natural approach. I've been meaning to try that actually. But I think that some trends that I really love, to be honest, I love medical aesthetics, but I also love Korean skincare too, right? And so when I went to Korea a couple years back, I've got some treatments done there. And what they had that was very, very popular is actually very trendy here in the States. And so I can't speak too much on it because it's not completely FDA cleared here. But all I can say is that I love Korean skincare, the trends that they have that's here. I believe in it. The results did work for me. And so I'd love to see it more in the States. Yeah.
I think when we were talking, you said something about microneedling. That
Yes.
You love microneedling.
Oh, yes. I feel like if there's one treatment that everybody needs, it's going to be microneedling because you're going to think long-term skin health, right? What's going to boost your collagen production? Starting your mid-20s, our collagen elasticity is actually dipping, right? And so we're losing some of that. And with the sun damage that we have, our skin is just going to get weaker and weaker. So we need to think what's going to strengthen our skin, what's going to help, boost collagen production, elasticity, and not only that, it's going to help with pores, texture, wrinkles, fine lines. That's just a staple that is safe for every single skin type. Men or women definitely need that.
So what helps boost collagen?
So boosting collagen production, you can do, like I said, microneedling. You can do laser, right? Certain lasers on the skin that's going to intentionally cause some type of trauma and reaction to your skin, and so it can resurface, right? Those are kind of using light therapy, using radio frequency. Those are all the different modalities that can be used on the skin to cause that intentional damage in order to help boost that collagen production again. So that's kind of how it works, yeah.
And what about, I think you mentioned elasticity?
Yeah, elasticity. Yeah. So, you notice a lot of times when clients come in and they're like, yeah, I just feel like a little saggy, not as tight. That's your elasticity. Right? We're getting a little bit more lax. We're not as tight as we used to be because that brings back to what I had mentioned. We're losing that collagen production. We're losing that elasticity as we age. Not only that, we're losing volume, okay? And even bone structure when you hit menopausal and up. And so all of that and all, that's why you're seeing some laxity in your skin, some sagging, some folds in your skin. And so during consultation, I educate my clients depending on what exactly their needs are and what is happening to their face in terms of aging. And that's how I kind of navigate and throw in a treatment plan curated just for them with different modalities.
Is there anything to prevent us from losing the elasticity?
Yes. So absolutely. Like I mentioned, skincare, right?
Skincare?
Skin protection, sun protection. Those are the things that's very, very important. Hydration, exercising, adequate sleep. You're not eating just empty calories. You're eating quality food that has high protein. Things like that are building blocks to collagen elasticity and tightening your skin. I think that you will definitely see a difference in that and kind of slowing it back without the use of, injectables yet.
Right. So what we put in our bodies, really.
100%. Yeah, what you consume is what you put in your body and everything. Mm-hmm.
Yeah.
Mhm.
And are there any like what's your favorite procedure to do?
Yeah, so I mentioned earlier my favorite, it has to be like a full facial balancing. I love a challenge where I am in front of a client that has different concerns, right? And I take a look at their face and there's volume loss or there's balancing that needs to be done or the skin quality needs to be improved. I love that type of challenge because it kind of makes me start thinking, these are the things that I need to incorporate for her or for him. And so full facial balancing, rejuvenation, that's kind of my type of thing and my specialty, I would say.
Okay. Are there now since we're talking about face, and balancing, do you, are there any types, how we have different shapes,
Yeah.
like U shape
Yes.
face,
Yes.
heart shape. I
Yes.
think I have a heart shape face.
Yes.
But are there certain like challenges that you see according to their
Yes.
type of,
Yes, absolutely. And I feel like that's where the artistry comes into. You kind of have to have an eye for these things, right? You have to understand the process of aging for the face and an eye for the artistic part, the aesthetic part. But yes, there's absolutely different face shapes. Like I've seen people who are more bottom heavy, right? Where they come in and they want to kind of create more shape to their face, more softer appearance to their face because they feel heavy here. There's certain treatments that you can do to kind of shift that, right? And there's patients that come in and they feel that they're too skinny or their face is too thin. Then there's definitely something that you can kind of thicken and provide gradual volumization globally to create more structure to their face. There's absolutely different types of aesthetic and faces that I work with on the day-to-day basis, and it helps me tailor treatments and what their needs are. But yeah, there's different everything.
Okay. What about are there like challenges that we face based on our ages, like
Yes.
40s, 50s,
Absolutely,
60s,
absolutely.
or 20s, 30s?
Absolutely. I have patients, I will say, that's even as old, no, mature as mature as in her 70s, 80s, I think. And honestly, those might be the most challenging because you know that there are limitations on what you can actually do. She's not ready for plastic surgery. That's just not an option for her. But she's looking for something, just anything to make her feel herself again. And that's where I love how my job comes into play. Like I light up with when I talk about this because like I said, it's just far beyond just vanity and augmenting, right? It's the connections I build and the impact that I can possibly make for my patient that's sitting in my chair. And so coming back to it, yes, there are challenges depending on the maturity, the integrity of their skin. Because I know limitations on what I can do. And if there's things that I know I can't do, that's where I refer out to plastics because, injectables can only do so much. Mm-hmm.
Yeah. Is there like a piece of advice that you could tell people who are watching and to prevent all of? I mean, you did mention
Yes.
sunscreen, having
Yes.
a routine,
Yes.
a skincare routine.
Having
Is there
a
anything
routine.
else?
Like self-care starts from within. Self-care doesn't mean go to the med spa. Even though I said it is a form of self-care, it really truly starts from within. Your self-love, your self-care, it starts from here, right? And how you take care of your own body day to day, and your routine. So like I said, your diet, your exercise, your skincare, those all come to play. And I feel that, there's no shame, even when you get to a point where you're like, you know what? I'm ready to look into this. There is absolutely no shame. There should be no shame for that. Because at the end of the day, it's about what makes you feel good. And if you know that you need a little bit of assistance, that's why we're here. And it shouldn't be looked down upon as vanity or insecurities. I feel that it's more empowering, like you said. It's actually, it's a sign of self-care, but nowadays and age, it shouldn't be frowned upon. And I feel that people are feeling more comfortable disclosing these type of things. It's just more relatable. It's more realistic, right? But
Yeah, it's for sure. I'm not sure a trend, but more normalized, right?
Yes. It is. It's all over social media. People who actually do consent, you see that. Like even obviously like celebrities, it's completely normalized. And I think that if people understand that what they see on the internet is not just completely natural, they'll understand how normal it is for people to engage in a little bit of self-care, right? A little bit of help.
Yes, exactly. Well, if our listeners want to reach out to you and know more about you, where can they find you?
Yeah, so I have two Instagrams. I have at the aesthetic intention on Instagram, as well as my second one is beautyboss__RN on Instagram as well. But yay!
And well, thank you very much for joining us. And we hope to see you again soon with more tips about.
Thank you so much, Louisa. I appreciate you.
Yes, and beauty is deeply personal, and do whatever feels good to you and for you to live the best in your skin.
Yep.
Thank you for
Because
watching.
you look good,
Bye-bye.
you feel good.